All right, hello everybody. I'm Brian, and this is AAMI News and Conversation. We're here at AAMI Exchange, Day 2 in beautiful Phoenix, Arizona. And I'm here today with one of our award winners. Connor Walsh is representing his entire group that won the Cybersecurity Award. It's specifically our AAMI Medcrypt Cybersecurity Visionary Award. And it's very important. It basically highlights the importance of cybersecurity and innovation going on there. And I was just telling Connor, when I think of the VA, I personally think of innovation because we see a lot of drive, a lot of information coming out of there. But Connor, why don't you tell us a little bit about your group, why you won this award, the importance of the work you do?
Yeah, absolutely. So the Medical Device Security Work Group's actually been around since 2008. It was one of the first work groups that was stood up in VA. It's comprised of 60 unique members from across the country. They make sure that the policies that we are considering or policies that we're getting passed down make sense from a hospital operations perspective. And so I guess one of the primary reasons why the Medical Device Security Work Group is so important is because we have a unique situation being a federal healthcare delivery organization. So we are bound by FSMA policy, which private facilities aren't. And so there aren't many federal healthcare delivery organizations. And so a lot of the federal FSMA policy that gets applied is oftentimes applied blanketly across the entire federal government. And that unfortunately sometimes captures medical devices. So the FSMA policy that's getting passed out is meant for traditional IT devices. There's not a very good, understanding of how that policy is going to impact medical devices because we're unfortunately looped into those policies. So the work group really helps translate that FSMA policy into making sure that operations is not impacted. We have a mission to take care of our veterans, and we need to make sure that that mission continues. And so that's what the work group really helps do. It's bridging that gap. So.
No, that's interesting, though, because it is still touching upon, I think, a subject that a lot of the folks in HTM departments have to worry about anyway, which is that overlap between what the HTM folks are doing and what health IT has to worry about, right? As you're saying, I think you mentioned before, it was 155,000 interconnected medical devices, networked medical devices within the VA, and that's just a drop in the bucket for total devices in your network, right?
Yeah, we have about 155 network-connected medical devices. We're seeing a steady increase with that, but we have about 900,000 total medical devices. So it's a subset of the overall the overall total that we have. But those 155,000 and 900,000 total are spread across our 171 medical centers across the country. And so we try to make sure that all facilities have a good idea of how to manage their network connected medical devices, and again, in a way that makes sense for healthcare operations. So.
Are you expecting that proportion to skew more towards more and more network devices?
Yes, we're seeing an intense increase. I think over the last year we've had about 15,000 medical devices networked alone. So
yeah, and I know you just came off stage where you were celebrating the award. Even when we wrote that script, we had said 140,000. Yeah. So there's that 15,000. Yes. My gosh, very short amount of time. So let's talk a little bit about what your group is supporting. I know there's a specific project that kind of helps drive your mission.
Yes. So the big thing that we've really been working on heavily is translating, translating authority to operate requirements to medical devices. So federal government enforces NIST policy for their ATO and their risk management framework process. And so the control framework that's being used today is 800-53. And that works well for certain systems, but in terms of the specialized nature of medical devices, it's a big burden to try to do that and apply those controls to medical devices. And so our group is really working closely with the FDA. We work closely with NIST as well, and trying to make sure that we're developing a more, customer-friendly authority to operate process for medical systems. We want to make sure that we're doing a proper risk assessment on the device and making sure that is never going to go away. But at the same time, we need to make sure the systems are available and they're available in a timely fashion. So if you were to do a normal authority to operate process, if you're starting from scratch, I mean, it could take you 2 years to get that authority to operate approval. And so that's not doable in the medical device environment. We can't have clinicians waiting 2 years to use a piece of equipment. So you need turnaround time. So it's a happy medium. And so it's that specialized, again, I go back to the bridging the gap, but it's that specialized nature of understanding the cyber requirements and where our Office of Information Technology counterparts are coming from versus the clinical impacts and the clinical requirements and what our clinicians need to do their jobs for our veterans. So we really help, again, bridge that gap, come up with a happy medium, and make sure that the devices that we are installing are cyber secure as possible. Yep.
Yeah. And for our viewers, I'm sure most of them are in the know, but for those who haven't caught on, we're talking about the cyber requirements that were derived from the omnibus bill. I think it was late 2023.
2022. Yep.
Oh yeah, December 2022.
That was yeah, it does. That was actually where we got in contact with the FDA. So once that omnibus bill came out and we saw the changes and the additional oversight that FDA now has, and we wanted to make sure we were kept up to speed as best as we could with that. We extended the olive branch and made a really good relationship with the FDA and their Division of Medical Device Cybersecurity. And yeah, it's been a really great partnership so far.
I'm glad you brought up collaboration because I know you have a lot of other partners and groups that you work with. Why don't you tell me a little bit about that?
Yeah, absolutely. So we actually meet with Mayo Clinic and Cleveland Clinic on a monthly basis, and we found those meetings to be very helpful. There's a lot of unique challenges in medical device cybersecurity. I think the one thing that we find is everybody's trying their best, but there's really no clear path for some of the challenges that we have. And so it's a really good opportunity to have that collaboration with Cleveland Clinic and Mayo Clinic and really running our challenges by them, seeing if they're doing something that maybe we can adopt or vice versa. I mean, they might want to adopt something that we're doing, but it's those intimate conversations where we really can dive into the unique challenges of medical device cybersecurity that really helps us. So we've been meeting with them for over a year now, I want to say. Well, with Mayo Clinic for over a year, Cleveland Clinic we just started up a couple months ago, and again, it's just been a huge and a great partnership.
I'm curious what kind of challenges, I mean, do you have any anecdotes or examples that you can provide?
Yes. So this is something that I think all healthcare delivery organizations are struggling with today, but it's the concept of unsupported operating systems in medical devices in our environments and how we are mitigating them. One of the big challenges in the VA is obtaining that risk acceptance. So, looking at getting 0 devices or 0% of devices in your healthcare delivery organization with unsupported operating systems is it's just not achievable. I mean, unless you're spending billions of dollars. And so we need to obtain that baseline. What is our risk tolerance for unsupported operating systems in our environment? And so we also talked to Cleveland and Mayo on what they're doing as well and really relying on making sure that we're not missing something. So unsupported operating systems is a big one.
This is, just for clarity, we're talking about legacy devices here.
Yes, yes. So anything that is Windows 7, Windows 2000, Server 2008.
Right, Microsoft isn't pushing out patches anymore.
Right, they're no longer supported. So that has been a unique challenge that we talk about regularly. And then the concept of remote support is another one. So there really is no standard for remote support for medical device manufacturers to provide 24/7 support to their medical systems. And so how are we tracking those remote support connections? How are we implementing them? Are we using site-to-site VPN tunnels? Are we using interactive service account logins? How can we make sure that the vendor's side mitigations are being met? Things like that. There was the recent cyber attack that happened a few months ago through Change Healthcare, and that kind of opened our eyes to the concept of a third-party vendor that we have site-to-site connections with potentially being impacted. It was a really good exercise for us, and thankfully nothing. We were okay. But that kind of discussion is very helpful, I feel like, with Cleveland and Mayo to making sure we're not doing something that we should be. So
for sure. So I obviously you're thinking about cybersecurity in a big way. This is a cybersecurity award, but I was curious if there were any other technological changes or advancements that you have your eye on moving forward.
Yes. So in VA, we implement segmentation and isolation of all of our medical systems on the network. So every medical device has a risk assessment performed, and then based off of that risk assessment, it's segmented in its own VLAN, and then that VLAN is isolated from our production network. With today is an access control list, so that's a Cisco first generation firewall. And on those risk assessments, we are asking the vendors, what are your required ports and protocols? What do you absolutely need for this system to communicate? Because our ACLs are written as a deny all by default, so no ports are allowed. It's completely shut down communication, and we only allow the communication that the vendors need. Again, ACL is our first generation firewall, so we are in the process now of migrating to the next gen firewalls that are going to give us the application level filtering that we want. I mean, it's a much much more secure technology, and something that's going to take our current medical device isolation architecture to a completely new level. And so that's something that we're working on as well. That in combination with a Internet of Medical Things tool, a network discovery tool, that's something that's extremely important. I mean, can't really protect what you don't know you have. So starting there and making sure we have a tool that works well is extremely important. And that's a huge piece of technology that you really can't implement a successful medical device cybersecurity program without. So
I'm wondering if, you're obviously developing a lot of lessons learned. You have these collaborators who may not normally swap information, but they're trading information for, learning within this community, the greater good. Are there lessons learned that come out of your group that can then be applied to other health systems, other private sector?
Yeah, no, that's a great question. So we actually are members of the Healthcare Sector Cybersecurity Council, so the HSCC. And last year, we were invited by Greg Garcia to give a webinar on our unsupported operating system strategy. So how we're tracking and documenting our unsupported operating systems. We have it's a key performance indicator that we track, but we require that 100% of unsupported operating systems in our environment are documented and also have a plan for replacement. And so that is something that we found very helpful. I mean, over the last year, we've been able to reduce the number of unsupported operating systems significantly in our environment with this KPI. It's a newer KPI, but we were able to share that with the HSCC work group as well. So
that's fantastic.
Yep.
So what's next for the group? Anything coming up?
So I mean, I think everybody was pretty excited to be a part of this, and this is it's been very, very exciting to win. I think that yes, we're still going to continue to try to I want to say forecast where medical device cybersecurity is going. We have 10 work groups right now, or 10 subgroups right now, all contributing to something unique in medical device cybersecurity. And so every year we do assess, hey, are some of these work groups do they need to be modified? Do we need new goals? Do we need new? And so that's never going to stop in terms of just trying to forecast as best as we can on what we can do better. So.
Well, we're going to keep our eye on these outputs. Just obviously more lessons to be learned. Thank you so much for taking the time to talk to us today, and enjoy the rest of Exchange.
Yeah, thank you so much for having me. Appreciate it.
All right.